Hi, this is a continuing program on borderline personality disorder based on the book, Borderline Personality Disorder, Survival Guide from Chaos to Authenticity. And what we're presenting now is the next criteria of borderline personality disorder as found in the DSM-5. And that concerns, affective instability due to a marked reactivity of mood. This is broken down into two parts, and the first part is affective instability. Affective instability refers to uncontrolled, rapid, and intense changes in mood, sometimes noted by a maudlin display and usually due to an anxiety-provoking external issue. As adults, we want to believe that we have the capacity and freedom to choose our destinies through decisions that we construct as individuals based on our needs, desires, hopes, and wishes. If we don't feel we're in control, then we cannot know who we are and we cannot influence or alter our pathway. The borderline often feels out of control. That is, he feels literally that he is not able to direct his life in a meaningful way, but rather perceives that somehow that other people or circumstances control him in a manner that leaves him feeling helpless and even worthless, so that he has no autonomy, no sense of agency, and so on. Living with the perception, which creates feelings that causes behaviors that the borderline cannot control his life or even his needs, is devastating and maddening and can cause affective instability. This prohibits the borderline from enjoying a sense of security in his life, which is essential to enjoying certainty and predictability, which in turn, of course, allows a person to feel safe and stable to begin with. Without a sense of control, it is no wonder that the borderline experiences unstable moods. Affective instability, along with impulsivity, means that the borderline may not be responsible for negative outcomes. A person who crashes his car during a seizure, which is basically an electrical storm in the brain, is not held responsible because he's not in control of the neurological synapse misfiring that caused the seizure to occur. While a person with a seizure disorder may not be ethically responsible, he may be devastated to learn that the neural misfiring robs him of his self-control and perhaps even personal dignity and safety. The inability to control mood can be just as debilitating as the inability to control behavior or thinking. Borderlines exhibit affective instability for many reasons, including significant reactivity of mood. Reactivity is a crucial word because it's clear that in many instances the borderline is reacting to an external stimuli that the borderline perceives as overwhelming or threatening, causing him to alter his mood. The borderline's reaction tends to be out of proportion to whatever caused the feeling of unease, and onlookers are often baffled and feel quite uncomfortable at the borderline's reaction. It is not clear why some borderlines change mood and not change something else. For example, when most people feel threatened, they do not change their mood, but rather their level of anxiety or even physically remove themselves from the danger or cower in some manner. Moreover, the borderline's mood may shift on a dime without apparent rhyme or reason, which makes the borderline feel that he is simply does not have control or understand his own emotions. It doesn't help that the borderline often thinks in black and white terms without the ability to properly perceive nuance, so that the mood instability is accompanied by extreme thinking. Perhaps the most serious issue with BPD is the cumulative effect of various symptoms, which find expression at the same time and inform one another, almost always in a negative fashion, and often accompanied by intense anxiety. And that's the second part of this criteria, which I want to look at now, intense anxiety. Mood and anxiety are related but separate phenomena. One of the challenges of a clinical evaluation is to understand personal and psychiatric issues as clearly as possible. Most persons with psychiatric issues are dual diagnosed, and the large majority of borderline suffer from depression and/or anxiety. How someone could live with BPD for many years and not have intermittent episodes of clinical depression and anxiety is unfathomable. Borderlines may experience acute anxiety due to various fears, including abandonment, social awkwardness, and pathological doubt, but also the inability to tolerate even moderate levels of stress that occur due to mundane change in the person's everyday life. If the borderline experiences a pattern of acute anxiety, then the borderline may also experience intermittent panic attacks. Panic attacks occur when there are discrete periods of intense anxiety, precipitated by either a frightening thought or anxiety-provoking issue, and which are recurring and unexpected, although not always. Panic attacks are characterized by a sudden, frightening sense of being out of control with a wide variety of physical symptoms, including heart pounding, sweating, trembling, sensations of shortness of breath, chest discomfort, nausea or abdominal distress, hot or cold sensations, numbness, lightheadedness or dizziness, feelings of unreality, and the fear of loss of control or even the fear of death. Many people with panic attacks also suffer with other somatic issues, that is, physical complaints that do not have a specific medical explanation or etiology, such as recurrent headaches, general aches and pains, loss of hair, reactive dermatological issues such as rashes, and various gastrointestinal issues. And with somatic issues, these physical symptoms become very preoccupying. Finally, the borderline's anxiety may also manifest through obsessional thoughts, that is, endless rumination, or even compulsive behaviors. When the obsessions and compulsions complement one another repeatedly, it can be quite similar to obsessive compulsive disorder, OCD. Thus, borderline personality disorder is often accompanied by clinical anxiety that can manifest in various ways. The borderline's reactivity of mood and anxiety due to uncertainty and general sensitivity to perceived threats is also closely associated with his sense of emptiness, which we'll look at in the next video.